Okay. Hello and welcome to the Clintrix AI podcast, where we explore the ideas, innovations, and leaders shaping the future of healthcare. I'm your host, Laura, and today we're diving into a fascinating and important topic: the quiet shift of healthcare, what patients actually want. So often, healthcare conversations focus on systems, policies, or technology, but underneath it all, we have patients, people, and their voices are reshaping the way care is expected, delivered, and experienced. Today, joining me to unpack this topic is Jordan Hansen, CEO of YourPathHealth. Jordan is a healthcare leader who's been at the forefront of rethinking patient-centered care and building models that actually respond to what patients need and not just what the system is used to providing. Jordan, I'm so excited to have you on the show. Welcome.
Yeah, thank you. It's great to be here, Laura.
Thank you for being on. So before we start, the first question: what first drew you into healthcare leadership and focusing on patient experience? If you don't mind
Yeah, so
sharing.
absolutely. My background started off as somebody who needed help and needed healthcare. So I'm a person in long-term recovery, and what that means for me is it's been 17 years since I've used alcohol or drugs
Wow.
to try to get through the day. And so my journey, in some ways, led me to both, some pretty tough problems and also at some point, I realized that because of the experiences I had something to contribute. So I went back to grad school, became a licensed alcohol and drug counselor, but I've been working in this field ever since, and try to bring a little bit of that personal experience as well as the clinical training and experience that I had to this issue.
Oh, that's really, really amazing and inspiring, if I say so
Yeah,
myself.
yeah.
When you look at healthcare today, what do you see as the biggest quiet shift in what patients actually want? And how different is that from what healthcare systems are used to delivering?
Yeah, I think we saw a huge shift during COVID, and the things that were deemed acceptable by organizations or providers or systems at large are just simply no longer acceptable. It's no longer acceptable for people to essentially be excluded from, the best of what technology has to offer and using fax machines and having to make phone calls when literally everything in our life is
Yeah.
convenient except for potentially the most important thing, which is how do we take care of ourselves? How do we take care of the ones we love, our family members? And so I think that for me was one of the bigger shifts. I also think that just the shift more globally towards empowerment. And there's two sides of this. One is very helpful, is empowering people to make informed decisions and driving, what they think is best for them and for their family. The flip side of that is a little bit less positive, is that through this empowerment, sometimes we get away from a focus on clinical efficacy, or we get away from the idea of a patient focus that's aligned with well-being, and we get into some pretty interesting territory when it comes to misinformation or
Hmm. Yeah.
empowering decisions that are maybe not in the best interest or of the client. So there's a lot to unpack, and it's been a really interesting world in these past maybe 5 years.
Oh, I agree 100%. I think COVID really changed the trajectory of healthcare forever, actually.
Yeah.
Many patients say they want more than good medical outcomes. They want empathy, transparency, and convenience. From your perspective, which of these non-clinical needs are healthcare organizations still struggling to meet today?
I think we have an interesting view of healthcare coming at it for, working almost exclusively with people with substance use disorders.
Hmm.
So, there's layers of stigma within healthcare, and they reflect the stigmas and discrimination and biases that are present in the larger community. And then on top of those existing biases and stigma and all that sort of thing includes the substance use, oftentimes medical issues that come along with substance use or mental health issues that come along with substance use. So, one of the biggest things that we see is how it's these intersecting pieces of discrimination play off each other. So we work a lot with perinatal populations, so new moms with substance use disorders, and I would argue that there are very few populations that are discriminated against as heavily as moms who are using drugs. The perception is that if you actually loved your kid, if you cared, that you would stop. And that's just simply not how any substance use disorder
How it
works.
works.
But it's
Yeah.
especially difficult for people to see how that interplay makes sense because it is illogical and it's very, very sad to watch. Um, and so that's one of the things that I just find interesting is the ways that we can empower people to feel respected and like they have dignity. And there's different ways to do that. Some of that is the magic of human connection that I don't think will be replaced by a technology. We can augment it for sure. But some of it is doing what we say we're going to do. It is showing up in a way that respects people's time. It's, how often do we just kind of take for granted that if we're going to go see a doctor that we're going to wait for 20 minutes or a half an hour or things like that. And so it's things like that that I think have people feeling safe and, feeling a sense of trust, which in our world is the best predictor of outcomes.
Oh, 100%. And I think that's a very unique challenge. I think when you speak on recovery care, recovery centered care, people tend to think of just, drug use, but no one ever thinks of new moms, freshly postpartum moms, and the stigma that's attached, with that. So that's actually really interesting.
Yeah.
At your Path Health, which is your company, you've emphasized evidence-based recovery strategies in human-centered care. Can you share how these approaches are put in practice and what difference it makes in patient care?
Yeah. So everyone in our space says evidence-based practice and person-centered care. If you go to all of our websites, they will all say that.
Say the same thing.
And, and having been a consultant and trainer and had the opportunity to visit lots of different settings, it's not always the case when you get to
Mm,
see the actual practices. We see what somebody might describe as evidence-based practice might not quite be what I would say is evidence-based practice. So one of the things that we feel is very important is to have consistency. And so this is less about having everything that we do be manualized, be rooted in evidence-based peer review and manualizing our treatments and therapies. I'm personally, as a clinical leader, a little bit less interested in that rigidity and the academic portion of it than I am with ensuring that the overall approach is one that supports the integration of evidence-based medical practices, evidence-based behavioral health therapies, and then recovery practices as well. Because I think what we see is that there's these gaps in between each one of those pillars of care that we are so far from evidence-based practice that we have some baby steps that we can take. And so one example is medications for opioid use disorder, so agonist and partial agonist medications. So think methadone, buprenorphine
mhm,
formulations. Those medications are have been proven to reduce the risk of overdose and they improve all the recovery outcomes, but there's still this tension between, not always, but sometimes between the recovery community and the medical community. They say a word like recovery, which for a doctor means something very different than somebody who might be a peer, or maybe they have background as a licensed clinical social worker. So
mhm.
really, as we're trying to develop our programming, yes, it's rooted in evidence. We incorporate motivational interviewing. We train on some elements of CBT. We do have structured manualized group and individual therapies. However, I think my little soapbox is if we don't have a way to talk to each other and our teams can't work in a multidisciplinary setting that actually supports that integration, we're really missing out. And then the second portion of what you asked, the patient-centered portion, everyone says they're patient-centered until a patient does something they don't want them to do. And this is another
Oh,
thing
yeah.
where it's the expectation within substance use care. You might still hear this in some places as we need to wait for them to hit bottom. You can't help somebody who's not willing to help themselves. That's not true. We have a mountain of evidence that demonstrates that is a dangerous and ineffective way to practice. They may not be motivated for complete abstinence, or they might do things that I, as a clinician, or even just as a layperson, will look at and think, that is not a good idea. Like
Yeah.
every time you use methamphetamine, you end up incarcerated. Like don't do that
Yeah.
again. However,
Yeah.
again, that's just not how this issue works, but I would argue that it's really not how most medical issues work. If
Mm-hmm.
you, and I don't know if your audience, exactly how many of them are providers or clinicians, but if we think of somebody that has high blood pressure, how many people are 100% adherent
To
to
their
their treatment
medication.
plan?
Oh yeah.
Like
Oh yeah.
nobody. I mean, some will do better than others. Some people are
Yeah.
largely adherent, but the idea that people need to be 100% adherent before we give them services, I would argue that that's very unique to substance use disorders. You have to
Mm.
be completely absent before we're going to accept you into treatment. And I just don't think that's realistic. And so one of the things we try to do is really help our staff monitor their own response to this work, especially in an epidemic of burnout and turnover and people leaving the field forever. We try to help our staff as best we can, understand the dynamic of when they're feeling annoyed, when they're feeling like, you know, nobody's listening to me. That's a good indicator that we need to sort of recenter ourselves and
Yeah.
check if we're truly being person-centered or we're trying to get our agenda
What
met.
we want. Yeah, like person-centered or
Yeah,
me-centered.
yeah, right. And
100%.
we all,
100. Yeah. I think that's a really unique challenge in healthcare. And I think it just comes with dealing with people, like different personalities, different wants, different just how people, behave and just the psychology of human behavior where it's like, being harsh or pushy might not always be the best approach, but it's also kind of hard as the provider seeing that, like you said, and being like, this is what you're supposed to be doing, but you're not doing that. And it can definitely be frustrating having to find that balance between being patient centered and at the same time wanting what's best for them and that continuity of care.
Mhm,
So we're seeing
absolutely. Well, and this is
technology. Oh, yes, yes. Sorry to cut you off.
no, it's all
Continue.
right. I could go on for like a half an hour. I just had like one small thing. I think one of the things we often say is that we use the word patient-centered, but we mean something different.
Mm-hmm.
And this is one thing that when we are unpacking even that term, um, our physicians went to school for a very long time. They are experts. I mean, they train others in this work. So it's this balance between meeting people where they are, but our chief medical officer says, but we don't leave them there. We meet them where
Oh,
they're at,
yeah.
but our job is to help them improve. And so that's the give and take and the muddiness
In
of things.
that
So
in that
sorry to
situation.
interrupt, but I'm
Oh
easily
no,
excited
don't be
about that.
sorry. It's a passionate conversation. I love it. I love it so
Yes.
much.
Yeah.
So we're seeing technology from telehealth to AI reshape patient expectations. And I know you've talked a little bit about this, but how do you balance the push for innovation intersecting healthcare and technology with the need to keep care still deeply human?
Yeah. I think that's what we've focused on throughout our existence is what pieces of this impede the ability for our clients or our patients to heal, what gets in the way of them feeling safe, what gets in the way of them feeling comfortable and taken care of and like we care about them, and that there's a
Hmm.
sense of urgency to this process that we're able to match when they feel a sense of crisis. We can meet that, not in a way that's overly, we're not in a panic and yet we do act with urgency. And I think one of the things very simply is having both product and clinical leadership at the table. I look at the leadership teams for some of the companies in the space, and I don't see any clinical staff. Or if there is a clinician present, it's somebody that has never actually practiced. It's somebody that maybe, they went to med school and never actually practiced clinically or didn't have a residency or a fellowship. And not that that often, it doesn't always mean that somebody actually is rooted in
Hmm.
the community, but that is one thing that I get a little bit worried about if I look at a company and I don't see any clinical background in the leadership team. I would also say that as we see more and more use of AI, there's so many different ways to set up a business model. And the
Hmm.
business models that I become worried about are the ones that are looking to replace human beings instead of augment the services that they provide. And every CEO has learned, well, most of them have learned that they won't say that explicitly. They won't say, well, we're trying to replace this. But when you see the pitch decks, which I have the ability to see some deal flow, you get to see how the business model is constructed. And that will tell you a lot about the actual commitment to that process. If the business model is rooted in replacing clinical staff and that's how they're
Mm,
selling into provider systems, I think that's very different than something that's looking to reduce administrative burden. So, it's a bit of an art. I think we're
mm,
seeing a lot of increased investment in this space. We see a lot more, frankly, just empty solutions and snake oil, which is typical. It comes in waves. About 4 or 5 years ago, when we were at the peak, I don't know what you call it, maybe a mini bubble. We saw a lot of nonsense, super high valuations and easy money. But the thing about healthcare is there's no such thing as easy money, if you don't have the chops on either the product and engineering side or on the clinical
mm.
side. You're going to get exposed eventually.
Really, really insightful. Um, if you could redesign one piece of the healthcare or hospital experience around what patients actually want, what would you change first?
Um, oh, it's such a big question. I think there's a couple things. And I know you said one. The one thing that
Or
we
two?
focus. How about this? Yeah, sure. I'll say the one thing that we focused on is there's a misunderstanding of what the emergency department does for our folks.
Mm,
So we partner a lot with emergency departments. Emergency departments are exceptional at stopping people who are actively heading towards death. That's
okay.
what they're designed for. They're very, very good for that. What they're not so good at is helping with the next step. And that's kind of where we come in
Mm,
is I think that people, I mean, we hear this a lot from our clients and patients is that they don't have access to healthcare outside of the ED setting. They know that they're going to be able to be seen there eventually, but it may take 3 or 4 hours. And then when they do get seen, um, their expectations are just not in alignment with what's being offered. And so, one of the things that I think would be a huge improvement, and we've seen some improvements with this already, is having the ability to circumvent that process even while people are in the waiting room. And this is really a fraud issue from a compliance standpoint because of EMTALA. EMTALA, the federal laws in the US saying that we have to treat anyone who comes through the ED, regardless of insurance coverage or not coverage or anything. Oftentimes, what we see is that people are so frustrated in that setting. And then by the time they get help, it's not what they were looking for, anyways. And it
mm,
just results in trauma and frustrations and all that sort of thing. So what we try to do is we create these avenues for if somebody is looking for, let's say they're in opioid withdrawal
yeah.
and they go to the emergency department. There's a way for us to make that process convenient and smooth for them that does not take up time in the ED, but it takes some investment on the workflow side. So that's one very, very, very specific case. But I think more generally, what we see oftentimes is a system that was constructed for compliance and billing. It was not constructed for clinical efficacy, nor was it constructed for patient experience. And that over several decades, we have a system that, if we really want to ask ourselves why we're doing anything, I think it's usually rooted back in compliance with either state or federal regulations or an accreditation body, or it's rooted in the desires of managed care. And very rarely do those things align with patient or provider experience. I honestly feel hopeful still, despite everything, because there is alignment between what patients want and what providers want. And I
Oh,
think that
yes.
we can achieve that in a way that actually might work for the other, financial stakeholders. So yeah, I could go on and on about that, but that's, I think, really where I see the most hope.
Okay. Well, I think that's very insightful. It's also like you said, it's an intersectionality of so many factors. But I think what's most important at the core is that the providers and the patients are on the same page, and it's more so, hopefully the system aligning and just improving in general for everyone and providing much
Mhm.
better services. So a little bit
Yeah.
about Your Path Health. This fall, Your Path Health is launching a statewide healing ecosystem. which sounds both ambitious and deeply needed. Can you tell us what this looks like in practice and how it could shift the way patients experience care across the state?
Yes, yes. So we've been working on this our whole careers, essentially, but especially over the past few years, preparing for what we're kicking off this fall. So when we say a healing ecosystem, what we mean is everything that a community has to bring to the table to support individuals and families struggling with substance use of any sort. But I would say that it's a little bit larger than that too, potentially. So when we think of the recovery process from substance use disorder, it's not just a clinical process, it's not a medical process. It's in many ways a very personal process. It's a psychological process. It's a community process. It's a family process. It's often a very spiritual process that's connected with culture and family and all those sorts of things. And so what we're trying to do is find a way for us to work together. Because most of my career was on the clinical side, but I also wore the hat of a recovering person. And I
Yeah.
also have, like many people with substance use issues, it runs in my family. So what we're doing is bringing everyone together from the residential treatment centers to medications for opioid use disorder programs to peer support, housing, food support, transportation, hospital systems, even the jail and probation, trying to have a way for us to communicate with each other. That's not a fax machine. It's not leaving messages at the end of a long workday when we're all, trying to keep track of the 16 other jobs that we have, but really at having the participant or patient or client, whatever we want to call them, at the center, bringing their family alongside and really working to establish a network of supports. It includes culturally specific support. So in Minnesota, where we're based and where we're launching the ecosystem, Minnesota has the worst outcome disparities between our native um, community members and their white counterparts in the nation. We have horrific disparities in outcomes across the board between our East African and Somali community members and their white counterparts, and also with our African American community members. And so, one of the things that we're really attempting to focus on is how do we help people? We don't have to be all things to all people, but how do we help people get to the places that were built specifically for them? We have incredible culturally specific recovery support programs throughout Minnesota. The trick is we have 90,000 people that are coming through HCMC, which is our big downtown safety net hospital. How do we take the subset of people that are appropriate for these services and help them get there, help them become aware of that and make sure that that's a warm handoff and not just a packet that they throw in the garbage, after they leave the hospital. That's really the goal. And we're super, super excited about it. We've been working on this. In partnership with all of our community partners and harm reduction organizations and peer support groups and hospital groups, all that for a long time. So as you can might be able to tell, I'm a little excited about it.
Oh, yes. Sounds very
Yeah.
exciting. And I'm also happy to hear your passion to help out marginalized members of the society that might not necessarily have equal access to these programs, even though, like it's like you said, it's much needed for them. And a lot of times, with drug use, it's not just one person. It's a history, it's a family history, it's multiple people. It goes down from
Mhm.
generation to generation, and it just affects more than just that person. So I think it's
Absolutely.
really inspiring work that Your Path Health is putting forth this fall with the healing ecosystem, also including the community, because I think it takes a community sometimes, not just the providers.
Absolutely.
That social support, some other coping mechanisms, because it gets tough, I believe, for these people. So good
Absolutely.
job.
I mean,
Good job on that.
yeah, we're so grateful for the support of our friends in this. Our role in many ways is very small. It's a transitional role. It's to try to help some pieces of the system, typically the clinical pieces, see the value
Hmm.
of the recovery supports and we say indigenous supports, and I don't mean indigenous in the sense of native or tribal communities, but indigenous of grassroots supports by the community for the community. Those are,
Hmm.
who are the people that you're going to call at
Oh, yeah.
11:30 at night? Who's going to be able to show up? Because it's not going to be somebody who has a CPT code that they're going to bill for. It's going to be somebody who cares about you and is in your community. And I think that's really the thing we got going for us.
Oh, yes. Are there any challenges you faced specific to substance use or your path health in general, building this healing ecosystem? And what are the goals you have for the next 6 to 12 months?
Oh, there's so many challenges. The one that comes to mind is a real difficulty of collaboration.
Hmm.
So much like, and what I guess I'll explain what I mean by that. Much like person-centered, everyone talks a good game. We all want to collaborate until it comes time to divvy up the resources, because there's not enough resources ever. Like our resources are just not sufficient for this time and our need. And so what ends up happening is we get protective of our organizations and our people, and oftentimes that creates conflict, whether it's explicit or not. And so one of the things that has been challenging and also really beautiful about this effort is there's a new movement, I would say, of recovery advocates. So it wasn't all that long ago that we didn't get a lot of buy-in from our medical community, or we did, but it was from like the same two or three physicians that had been around for a long time. Now, when we do a training for residents or fellows or even med school students, we're seeing a incredible mission-driven desire to help the community, and that's new and beautiful. I would also say that we have a new opportunity to bridge what has historically been a really, really wide gap between the recovery community and the harm reduction community. And I'm a board member of an organization called Harm Reduction Sisters in Duluth, Minnesota, up in the northern part of the state. Historically, places like Harm Reduction Sisters, there was not necessarily a lot of collaboration or the ability to collaborate with recovery organizations because of the rigidity of, at least this is just my view, the rigidity of the recovery community. Historically, there's been fighting. We're seeing a huge opportunity that the folks that are advocating for recovery, like truly person-centered recovery, are also the ones that are advocating for harm reduction. And even if we don't do everything the same, we believe in the inherent dignity of all the people that we serve and that they should be treated with compassion and that we're there to be helpful, not to judge. We have the ability to work together. It's both a huge challenge, but also I've been really hopeful because we have these new ways of organizing that I think gives us a real new opportunity to be effective in a way that has been really difficult earlier on in my career.
Thank you for sharing.
Yeah.
If patients listening to this could take one action to advocate for what they want in their care, what would you tell them?
I would say don't give up. And this is such a trite saying, I don't know if I can swear on here and I'm not going to, but that would be my reaction to hearing something like that. But what I mean specifically is there is a pathway for you. There is a pathway out there that is yours and fits you perfectly. And it doesn't necessarily need to look like everyone else's, but there's other folks that have gone through this and you're not alone. So it's this tension between there's a huge community of us. There's 25 million people in the US who describe themselves as living in recovery. I mean, there's a lot of us, and hopefully people can find something that fits them. So I would say don't give up in looking for that. Everyone deserves a chance to heal, and recovery is for everybody, and yours can look however you want it to look. Um, and also, there's a chance that you might be able to learn something from some of the folks who've been doing this for a little while too.
Well, thank you. Thank you so much. Thank you so much for sharing. Do you have anything else to share before I conclude this episode?
I don't think so. I'm just really grateful for being able to share a little bit about what we're working on. And I would also say that part of this for us is, like I mentioned, intensely personal. And so, if anyone does want to connect, they can find me on the internet. I'd love to connect. If I can be helpful to anyone, I'd love to be helpful.
Today's conversation reminded us that what patients really want isn't complicated. It's care that feels human, transparent, and supportive. Whether through evidence-based recovery strategies, innovative technology, or statewide healing ecosystem, the quiet shift in healthcare is about listening more closely to patients, redesigning care around their needs, and leading with empathy. If you take one thing from this episode, let it be this: the future of healthcare belongs to organizations willing to put patients at the center of every decision. And patients, like Jordan has said, don't give up. keep advocating for yourself and, forging your own path, because everyone's journey looks different. It's not a linear journey. Stay true to your path and don't give up. Thank you for tuning into this episode of the Clintrix AI podcast. If you enjoyed today's conversation, please follow and share this episode with someone who cares about the future of healthcare. We'll be back soon with more conversations that spotlight the people and ideas transforming the way care is delivered. Until then, take care, and I'll see you in the next episode. Bye.